time to be well with your health. I'm Nimit.
I'm Shanna.
Welcome to Adventist Healthcare and You podcast. We are back with our new episode today, and our topic today is chronic conditions and mental health. Shanna, did you know that about 133 million Americans are living with chronic conditions now?
I didn't know the exact number, but I did know that many of us have something chronic that is affecting our quality of life or our daily lives.
Yeah, that's a significant amount of
It is.
people. And we need to talk about that more just so we could be aware of it. And to discuss this more, we have our two experts, Michelle Brinson and Hannah Jessie Adonton. Michelle is a behavioral health therapist with Adventist Healthcare Outpatient Wellness Clinic, and Hannah Jessie Adonton, the nursing manager with behavioral health at Adventist Healthcare Shady Grove Medical Center. Welcome.
Thank you.
Hi, thanks.
Yeah,
Thank you for coming. So we're talking chronic conditions, but we're talking about a mental health component of that starting with not only is our physical health important, but our mental health is just as important. How does having a chronic condition affect our mental health, or what can we do to support ourselves?
It does affect us. Any chronic medical condition affects us mentally in the sense that you find the person finds themselves dealing with different things that affects their activities of daily living. And the fact that they are unable to do things like they used to affects them. They feel hopeless and they feel that they need to isolate themselves. They feel anger. They feel a sense of, low self-esteem because suddenly they're dealing with something that is different in their lives. And especially when it affects their work, then that exacerbates their mental well-being. So you find people getting into depression.
You can also experience health-related anxiety, the anxiety about your health conditions. That's something that affects a lot of people. Or you can develop general anxiety. The more worry we have about one thing, the more likely we are to worry about a lot of things. And a chronic condition, as we all know, is something that's ongoing for a long period of time. It's life-changing. And so that can create a lot of anxiety, unknowns about the future.
And even when you said, impacts work, impacts our daily life, even, a lot of people have diabetes, for example, type 2 diabetes, that could affect even just the foods that they eat. And so even, and food is oftentimes central to people's lives and families, and having to do it differently really may impact their enjoyment or the way they typically would interact with family or friends. And so that's a tough thing to deal with.
Yeah. And a lot of times in mentioning diabetes, together with hypertension, you're dealing with other conditions that trickle in that affects the person's social life and their intimate life, and such that they are unable to interact well with their partners. And that is a big, big component that can send them downhill. And, like I said before, brings on anger, brings on this isolation, feeling like everyone is looking, seems to see what is actually going on with them.
Is it accurate to say if you have a chronic condition like diabetes or hypertension, heart disease or something like that, and if you have a mental health component to that it can actually make some of the physical symptoms worse too?
Exactly, yes. It makes it worse because not only are you dealing with the physical condition, you're also thinking about a lot of things. You're worrying about a lot of things that are going on in your life. And so it drives the individual to do other things. Even though they have this mental health component, there are other things they find themselves doing. Added to the stress that they encounter, they might resort to drinking, even though they know it could trigger mental health or exacerbate their condition. They resort to drinking, other substances, using illicit substances, or resorting to self-medication with other things that they find themselves.
So when an individual gets to that level about their leaning towards substances or other avenues that are not healthy, how come family members, how can they assist them
or
go
their,
through that.
yeah,
Or
or
their
their
loved ones. For physicians too, yeah.
It is vital that they have that support, because you realize that with chronic mental illness, for example, having that support system would go a long way in helping the person find balance. because that support system will encourage them to follow their treatment regimen, because that is vital. Because once they lose sight, they lose that, then they start going downhill. So having that support in their lives makes a difference. But as you know, having that support system presupposes that the individual is willing to also work with that support system. Because a lot of times, depending on where the person is, they might decide to give up, or they get so stressed that they don't want to continue, or they just self-destruct. So there are a lot of things to work out with that too. And having the loved ones be a good support system without being enablers.
Yeah. I think it's a vicious cycle, right? Because you want to make sure that they have the drive, but they may not have the drive because they may be depressed or have anxiety or things along those ends. But Michelle, you mentioned anxiety and depression. What other mental illnesses are impacted with chronic conditions?
Symptoms. Yeah, symptoms.
Yeah, definitely symptoms. So I just want to kind of make a little clarifying statement here. When we say depression, we're talking about clinical depression. There are a lot of components that have to kind of fall in line for it to be considered clinical depression. But you can have depressive symptoms, sadness, hopelessness, lack of interest. Those symptoms, there have to be 5 of them in place to meet the criteria, and they have to have been in place for a minimum of 2 weeks. So just saying that someone, well, she seems sad, so she's depressed, not quite
Not
the same. You know, but when we are dealing with diagnosed depression, that's something that we want to make sure that caregivers are doing all they can to support the person. There's a lot that you can do that you may not even be aware of. Lots of little things, small coping skills, different activities, keeping yourself active as possible, keeping as engaged in things that you enjoy as possible. All of those things add up to helping to improve the mood.
It's very normal then for someone with a chronic condition to have anxiety, to have either depression at some point or some of the depressive symptoms like sadness or feeling low for a little while. And then really important for the caregivers and our loved ones to be on the lookout and offer some of those coping things that you said.
Yeah, absolutely. I think another thing that's really important for caregivers is to be as open to hearing what you have to say and non-judgmental as possible. So if somebody is already feeling vulnerable because they have a chronic health condition, they're already feeling like, well, I'm less than, it's going to be really hard for them to open up and say, not only do I have this health condition and I'm vulnerable in that way, but hey, I'm also feeling really sad or down or isolated. You have to make that space for them. You have to create a safe space for them to be able to say that by being non-judgmental. If someone comes to you and says, hey, I'm feeling really low, that was brave. You know, and you have to kind of acknowledge that. But what you don't want to do is you don't want to say, oh, I don't feel that way, or you shouldn't feel that way. What else are they going to be able to share with you? Just being able to say something more along the lines of, that sounds really hard. How can I help?
Yes. And I like what you said too about not being judgmental, even in the sense if they say they're feeling low or something like that, like let them have those feelings. But also on the other side of that, as a caregiver with someone that has a chronic condition, not being judgmental when maybe they're struggling with managing that chronic condition and making them feel bad, like, oh, you shouldn't have eaten that because of the, your diabetes or whatever, like being there to help them manage it and not being judgmental when they might not do it exactly the way maybe you would, or, because it's hard.
So much better to say, good try, good effort today. Yeah. I saw that you really wanted to. We'll get them tomorrow.
Yeah. And I guess the same is be kind to yourself too. If you have a chronic
self-compassion.
There you go.
Absolutely. I didn't do as much as I wanted today, but I'll get them again tomorrow. I'll keep trying and I can improve. That upward spiral is really going to be important as opposed to creating that downward spiral of, oh, I didn't do it. Oh, I'm never going to be able to do this. And then all of a sudden we're feeling really defeated. And when you feel defeated, you don't want to do a lot. Yeah. You don't even want to take your medications sometimes. You don't want to follow your regimens.
Yep.
And to add to that, the feeling of not being judgmental as we already know, with anything that has to do with mental illness, there's already this feeling of the stigma, the issue of stigma, because not only do we have the societal stigma, we have the individual themselves have feeling that stigma as an individual. So that affects them. So making any statement that makes them perceive that you think there's something outwardly wrong with them makes them want to shut down. That is why we need to be open
and talk about
it.
Yep.
Yeah, and I think from a caregiver's perspective, like it's very important for us to encourage them to speak more, but also from the patient's perspective, I think we want to encourage them to speak as well. And if they don't have that relationship with their provider, maybe it's time to change providers or look for someone that can build that relationship with.
And that your primary care provider is there to help you, or your other physician, whoever is taking care of you, whatever your provider is that not only talk about your physical health, but add in how you're feeling as well, because they can help you find the resources like Hannah and Michelle.
I think one thing that's going on today that maybe wasn't happening as much 10 years ago that I'm really excited about is every time you go to see a provider, they're going to ask you at least those 2 PHQ-9 questions.
Mm-hmm. And what are those?
They're usually, have you been feeling sad, down, depressed, or blue? Or have you been feeling hopeless?
And that's to start a conversation to help you find the resources that you need. And sometimes it is just talking about it. So just opening that door is important.
Yeah. And more, we find a lot of the facilities having this integrated care.
Yeah.
Where you have like a one-stop shop, so it makes it easier. And I think people more and more are beginning to understand the importance of mental health, that it is a necessity. There is nothing to be ashamed of.
Yeah,
It needs to be taken care of.
Our bodies and our minds are all part of the same system.
Yep.
And, one thing that's great about the way that our bodies and our minds are designed to work together is that simple act of talking creates happiness chemicals.
Exactly.
Even if we don't solve your problems today, the fact that you got the opportunity to just kind of get it off your chest and talk about it creates these chemicals that you'll walk away going, oh, I feel better now.
Yeah.
I don't know why.
Yeah.
And that is why we are combining the treatment, pharmacological treatments with non-pharmacological treatments like psychotherapy with medication component, because together they help the individual who has a need.
Absolutely. So on the one hand, medication can help kind of lift the mood up, reduce the anxiety to a point where you feel like you can get out there and start utilizing coping skills. And then psychotherapy comes in and says, hey, here are your coping skills. What can we do? And they just kind of go hand in hand.
So what are some of the community resources out there or peer support groups that individuals could utilize out in the community who are living with chronic conditions, have some mental health history as well?
So I know that there are different groups. You can do a very quick search on a website like Psychology Today just for chronic conditions groups. And it'll pull up different groups in your area, whether or not they, take your insurance, whether they're free. You can investigate that there. Then there's private groups that also have specific groups about pain management or specific groups about caregiving. I know I've referred a lot of people to caregiver support groups because we also have to remember that the caregivers have to be good in order to give the care.
Yep.
I think the county also, depending on which county you live in, the county has lots of resources. Going on the website and searching, you can find a lot on mental health, ACT teams, different resources out there for individuals.
And even finding support groups that have your chronic condition may allow you a opportunity to learn from others, learn that you're not the only one. And as you said, Michelle, talk.
Just
And
get
just get it all out there. Yep.
Talk therapy.
Yes.
People in support groups actually learn from one another.
Yes.
Someone might bring up, hey, this is what I did to help feel better today, or this is what I did, how I learned to manage my medications and my foods better. And then other people go, oh, wow, what a great idea. I should do that too.
Yep.
Yeah. I had a patient once tell me, we need to talk more about all these mental illnesses, and that will help other people come out and express their need.
Yeah.
Well, we often say, how are you feeling? And you kind of list, oh, my knee hurts or this or that. But really, also that mental part of it, that emotional, how are you feeling? And yes, that's not just when you're with your provider or whatever. It's not just the physical part of it. It's what you're feeling inside.
Yeah, absolutely. Sometimes it's even a better question to say, where would you put your mood on a scale of 1 to 10? That's something that I open a lot of sessions with my patients with, so that they don't have to try and find the words to express it, but they're like, okay, so if 10 is happiest and 1 is I'm feeling lousy, I'm about a 5 or I'm about a 6.
Yeah.
And then you can kind of take it from there. Okay, what would get you to a 7? Or why do you think you're at a 5 today? What can I do to help?
That opens up the line of communication, because when you ask from 0 to 10, rating the mood, like we do that with our patients, you start talking even before you know it. You're discussing some other things and their mood suddenly changed from where they were before.
And I love all of these tips that you've given throughout here, because they're all things that we can ask ourselves too, and assess how we're doing inside as well, and decide, maybe I do need to talk out loud. Maybe I can call someone, or, asking ourselves these questions is important too.
I think it's, making light of it, even though it's it
feels heavy.
A heavy thing to ask. I find myself asking myself, I'm like, how are you feeling today? I mean, do you have any thoughts? I mean, what is your mood? And it's like, Mom, I'm not your patient. I'm like, no, we're talking, because I believe when we talk about such things, often it makes it easier. It doesn't feel like, oh, there's something wrong with expressing how I'm truly feeling or how the individual is truly feeling. Yeah. So talking more about it makes it normal for people to open up.
Open up, yeah.
Well, these have been wonderful tips and great discussion on, if you have a chronic condition, some ways to help and manage it. But also, even if you don't, these are still some wonderful tips on if you are just, not feeling like yourself. So thank you. Is there anything we missed today that you want to address or add for our listeners?
Well, I just wanted to add in that, we have a lot of control over managing our own moods. So if there are things that I know that if I go for a walk out in nature, that usually is going to bring my mood up. Or I know that if I just sit in some sunlight for a little while, I tend to feel better. Do those things when you know that you need to, because a lot of times depressive symptoms or depression, if you're suffering from real depression, can cause you to do the opposite of what you need to be doing.
Yeah.
And so we have that one coping skill we call opposite action. So if my depression is telling me to lay in the bed and not get up and wash my face and brush my teeth, then I know I have to do the exact opposite. of that.
Oh, that's great advice.
Yes. Yeah. And even those two things that you mentioned, like sitting in the sun or taking the walk, if you have a chronic condition, those things can often help that. Just lifting your mood will help you. Yeah. Your stress levels might come down. Or
when my mood
anxiety.
is better, I start to feel optimistic instead of feeling hopeless. I start to say, what can I do? What else can I do? Well, I feel a little better right now. Again, Let me go try something else.
Yep, all connected.
Yes. So. Because any form of exercise, it could be dance. I mean, you could just walking or start dancing, if that is what if you're kind of confined to a chair, do some stretching in your chair. Chair yoga is a good thing to try. Oh, that's something I came across the other day. I was like, okay, I haven't exercised. What can I do? So you realize that those simple things, when you start doing them, lifts your mood.
Yeah.
So those are things you can do or tell others about to lift up their mood.
Wonderful. Well, thank you both for being here. And thank you to our listeners. I hope you enjoyed this podcast today. To learn more about mental health services at Adventist Healthcare, visit adventisthealthcare.com/mental health. And to find upcoming health and wellness classes, visit adventisthealthcare.com and click on classes and events. We do have some support groups out there available. And we would love to hear from you. Leave us a rating or review wherever you listen into your podcasts. If you have a health topic you'd like to hear more about, send us an email at podcast@adventisthealthcare.com. Don't forget to like or follow our podcast so you get all of our new episodes. Thank you, Michelle and Hannah, again. And thank you to our listeners, and be well.